Household necessities are disappearing from store shelves as virus-induced panic buying takes hold of Taiwan.
Our reporter Stephanie Yang spoke to Sophie Liang, a psychiatrist at Chang'an Memorial Hospital, to explore the psychology behind panic buying.
Dr. Liang also has advice for how parents can talk to their children about COVID-19.
Visitors surge into stores. Amid the pandemic, shelves have been emptied across the world. In Taiwan, after the 100th COVID-19 case was announced Wednesday, shoppers flocked into supermarkets to stock up on non-perishables such as instant noodles and canned goods, and daily life essentials such as tissue paper. Why is this happening? An expert says it's because people are searching for a sense of control during a time of anxiety.
Feel to the unknown, feel like everything is changing in your daily life, and about you don't know what it will be in the future. So this kind of insecure, I think that people will have some defense mechanism. I think buying is a kind of a reflect to the defense mechanism to the feel. People try to buy things to make them feel like they do something for themselves, just like before people buying the mask.
Ready for the worst.
Across the United States, Canada, and the United Kingdom, some supermarkets have imposed a cap to limit the supplies a single shopper can buy. Is this panic buying necessary? The psychiatrist says there's a difference between preparation and panic buying.
I think it's quite hard to say the necessary, because sometimes something that people buy is not really necessary. That people should kind of awareness to it's a kind of a rational or irrational. For example, 10 packs of toilet paper, that's too much. But maybe buy something really necessary, you can feel safe, it's okay.
What can people do to cope with stress during an infectious disease outbreak? The National Child Trauma Stress Network, established by the U.S. Congress in 2000, listed some steps that families can take. Communication is important. Keep up to date on what is happening with the outbreak through credible media outlets and public health authorities, but limit exposure to media that might instill fear. Secondly, maintain a consistent routine when it comes to meals, bedtimes, and exercise. Thirdly, engage in proper hygiene, such as hand washing. Lastly, engage in self-care.
Try to listen to what's going on in your heart. For example, is the overwhelmed anxiety, is a worry, and if really necessary, maybe take some like a mindful breathing to calm yourself, or try to do some exercise or activity. Stop the media and to go back to your central over yourself and to think about that. Engage the routine you need to do, and engage something you would like to do. And if you're a family, engage your family life. Go through the storm of the COVID virus with the children.
Due to schools being suspended and classes moving online around the world, children can also be susceptible to anxiety. Taiwan's Ministry of Health and Welfare has launched a website to help parents help children cope with COVID-19. This website has articles in Mandarin, English, Indonesian, and Vietnamese. The content emphasizes the fact that it's important to protect children both physically and emotionally. It recommends something called the PEACE method, which stands for 5 ways to stabilize mood. PEACE is an acronym that stands for play games, enhance sense of security, accept your emotion, change the behavior, and engage in life.
I think the first of all, just talk to them, and you can kind of hold a family meeting, choose a very comfortable place and to talk, and to explain what's going on, and use the language level they understand. Or the second way, you can kind of use a play. Play, for example, doctor and the patient. Closure, the emotion is also important. And just let the children or the family member to have a chance to ventilate either their worry, their fear, or their anger.
The psychiatrist says that if a loved one is having a difficult time coping, there are ways to get help. They include seeking out a trained counselor or turning to resources provided by trusted public authorities. For Formosa News, Stephanie Yang, Huang Yanchen in Taipei.